Hello everyone. So, am I audible? Is the screen clear so that we can start the session? So, those who have joined, they can tell me, am I audible? Is the screen clear so that we can start the session? This is the session of, so we have already discussed 2020 NEET PG question papers 2019 and 2018. Today I am going to discuss two papers. One is 2017 and 2016. Okay. So, yes students, am I audible? And so that we can start the session now. Let me just check. Okay, so yes, I am audible. Is the screen also clear? Yes, Sri Rangaraj has joined. Okay, good morning Sri, good morning Sri. Yeah. So, okay, this is the discussion of NEET PG 2017 Anatomy MCQs. Okay, so I will suggest students who have just missed out, do join this and see the sessions. Now, also I want to tell about free live sessions on the Unacademy platform. So, the free live sessions, if you want to see the live sessions which is absolutely free on the Unacademy platform, use my code ANAT10 and can be the part of these sessions. So, what is the unlock code which can be used? ANAT10 is the unlock code which can be used for seeing the free sessions on the Unacademy platform. You have to download the Unacademy app and then you can see the sessions. Okay, the users who are using the Unacademy app for the first time, they can use the code ANAT10 for unlocking. So, my dear aspirants, now telling about the yearly Anatomy MCQs discussion. So, 3 papers has already been discussed, that is NEET PG 2020, 2019 and 2018. Now, I am going with the discussion of NEET PG 2017 question paper, and after completing this again 11 AM I will discuss 2016 paper. Okay. Those who want to take the plus subscription should use the code ANAT10 and they can take the plus subscription, and this will be highly beneficial. Use the code ANAT10 to unlock and take the plus subscription of Unacademy, or use this as a unlock code to see the free sessions on the Unacademy platform. I also want to give you a brief account of the free sessions on the Unacademy platform, so which is absolutely free, and what is the benefit of seeing the free sessions on the Unacademy platform. So, my dear students, first thing is that it's a first thing which I want to mention, that it's an interactive live session where you can interact live with the educators on the platform of Unacademy. Polls are conducted, so whenever I also take a session, 90% times the polls are conducted, and it is an MCQ session with a description. Along with it, polls are conducted, so you can be this is the session which is taking on the, I am talking about now, yes, Robin Bhagla, I am talking about the special class features on Unacademy platform. Okay, so yes, last sessions, yeah, last sessions are all on the YouTube. So, YouTube pe hai, last sessions are on YouTube sessions, YouTube. Okay, so just YouTube. So, just yes, I just want to tell, yeah, this is the yearly Anatomy MCQ discussion. 5 papers are there. Okay, 5 question papers I have discussed. Today I have discussed 2020, 19 and 18, and now 2017. So, 5 years questions should be extremely important for you to revise. So, yes, you can just see and search for Dr. Monalisa session of study. So, you will get sequentially the session link. Okay, just check on Let's Crack NEET PG. Okay, so you will get that all session links. So, raise your hand and ask doubt when I am in the present in the platform of Unacademy live session. Never miss a session. So, what happens when you see the sessions on the Unacademy and you start following the educator, for example, Dr. Monalisa, you start following me, then you will get a notification regarding all my upcoming session, and it's always you are not able to miss out any of this. Lecture notes are provided, PDF notes. After completion of the session, you will get PDF notes of the session. You can download the PDF note, and this is extremely beneficial, and this is making the special class of Unacademy superior, more superior than the YouTube free sessions. Okay, anytime, anywhere, read from the your own place and have an interaction, get your doubts clear live, and this is all the features of special classes. So, my dear students, download the Unacademy app, use the code ANAT10 and be the part in the special class. Now I want you to tell about the plus subscription. So, students, the plus subscription has got another benefits. Actually, you can access both the live and recorded version. So all 19 subject you can access it, and you can be present for both the live and the recorded version. If you have missed out, sometimes what happens, students tell me, ma'am, I was not able to see the live session, so what will happen? So nothing to worry, you can also have see the recorded version, but what I suggest, go for live session, because at that time itself you can ask your doubts and you can interact with the educators. But at times, due to your academic load or personal engagement, you are not able to attend the live session. So for that, what you have to do, you have to see the recorded version of the session, and there is no limitation of number of times seeing the session. You can see multiple of times, there is no restriction of number of times. Study from your place at your own device and have an interaction with top educators of Unacademy platform. Learn from top educators of medical field. Access to more than 25,000 latest MCQs which is on the platform of Unacademy, which is based on the latest pattern. A detailed description and explanation is provided for each and every MCQs by the top educators of Unacademy platform. Compete in live tests and quizzes, and coming soon is the printed notes with the 12-month and above subscription. So don't miss out this. It's extremely important that you should take the printed notes of Unacademy by taking the plus subscription. Use my code ANAT10 to get 10% discount. Now I also want you to tell about the description of iconic subscription. So this is making the subscription more superior. Why? Because you can access two important platforms: India's largest online platform, that is Unacademy teaching platform, and the other is PrepLadder. Okay, so these two platform in the medical field is we know that PrepLadder has got dream team of faculties, and you can access all the video recorded lectures of Dream Team, clinical integrated essentials, also video lectures from Dream Team. QBank 3 can be accessed, rapid revision, snapshots, and tracer dream notes will be provided to you. So all these benefits can be accessed at a very low cost, where the two platform benefits can be accessed by you. For this also you can use my code ANAT10 and get 10% discount. Now I also want to share an important information with you, that is boost your medical PG preparation with an amazing limited offer. So this offer is limited. Use a code, so you can use my code ANAT10 for getting 10% discount, and after using this code you can take 2 years of subscription and you will get 4 months of subscription absolutely free. So by taking 2 years of subscription, 4 months of subscription is absolutely free. Use my code ANAT10 and get 10% discount. Now my dear aspirants, I also want to discuss the NEET PG 1 month package. So if you have already completed your 2 times revision of all 19 subjects, just go for 1 month package. So if you are confident with all the subject, that is the point. So in the 1 month package you can have ultra high fast read, so you will have ultra fast track revision batches, you will have emergency room MCQ batches, NEET PG test analysis batch, last 3 years of MCQs, previous year questions of all 19 subject, COVID test and grand test series. So all these benefits can be accessed by you, and you can use my code ANAT10 for getting 10% discount. I also want to share the information of 4-year subscription, extremely important for those students who are in the first year or second year. They can have their all university exam cleared along with the next. And also want to share that by taking 12 months of subscription, get 2 months of subscription absolutely free. Now at the end, what I want you to show is the pricing comparison of NEET PG subscription with that of the iconic subscription. So that comparison will be shown to you. You can see that is the either you can go for 4 years or 3 years, 3 years subscription of Unacademy, or you can go for the iconic where PrepLadder is also merged. And for the students of 4th year or the interns, they can just take 1 year of subscription, that is enough. So this is all for the details. So just take the subscription, use my code ANAT10 and get 10% discount. And my dear students, so now just 6 to 7 days left for the getting the printed notes with Unacademy platform. So that is all the benefits added on. So just go for it. So let's start with the MCQ session. Let's start with the first MCQ of today's session. Okay, all the best students. So I will just give you 30 seconds, otherwise I will explain, don't worry. So quickly we will discuss all the MCQs. Okay, extensor carpi radialis longus is crossed by which of the following muscles? Extensor carpi radialis longus is crossed by which of the following muscle? everyone. So this is the first MCQ for today's session. According to you, which is the correct answer? 4 options are there, A, B, C and D, whether it is abductor pulsus longus, extensor pulsus brevis, extensor digitorum or indicis, or it is abductor pulsus longus, extensor indicis, brachioradialis. So according to you, which is the correct one? So just go for it. If it is wrong also, nothing to worry, I am here to explain. Okay. Extensor carpi radialis longus is crossed by which of the 2 muscle tendon? Okay. So yes, students have started giving the answers. Okay, so my dear aspirants, I will just explain the answer. Actually, extensor carpi radialis longus is the muscle of second extensor compartment and it is crossed by the muscle of first extensor compartment. The answer is abductor pollicis longus and extensor pollicis brevis. Okay, so the correct answer is A, and I would like to show you a diagram for it. So see here, extensor. So extensor carpi radialis longus is lying where? Extensor carpi radialis longus, as I told you, is the muscle of second extensor compartment and it is crossed by the muscles of first extensor compartment. Okay, it is crossed by the muscles of first extensor compartment. So see here, it will be crossed by abductor pollicis longus. This is the muscle of first extensor compartment and extensor pollicis longus will be the muscle of third. So we have to go with one. So the correct answer is first group of muscle, first extensor compartment is crossing it. Let me show you a diagram for it. So yes, you can see here, this is the extensor carpi radialis longus tendon and the 2 muscles which is crossing it. So this tendon is extensor carpi radialis longus and the 2 muscles which is crossing over it, as I will show you with this. Okay, 2 muscles are crossing it and they are abductor pollicis longus and extensor pollicis brevis. So clearly in this diagram, you can appreciate the 2 muscles, that is of first compartment, is crossing the muscle of second compartment, that is extensor carpi radialis longus. Yes, very clear. Okay, everyone. So let's move on to the next. Which of the following is the derivative of Richard's cartilage? Which of the following is the derivative of Richard's cartilage? Whether it is stapes, malleus, incus or sphenomandibular ligament? Sphenomandibular joint. So according to you, which is the correct answer? Which of the following is a derivative of Richard's cartilage? Stape, malleus, incus, sphenomandibular joint. You can write A, B, C or D. Derivative of Richard's cartilage. Okay, so actually Richard's cartilage, I will give you the hint that Richard's cartilage is the second arch. It's the cartilage of second arch. So you have to just tell me which of the following is the derivative of second arch. The correct answer here is stapes. Okay, stapes is the correct answer. Actually, stapes is the derivative of Richard's cartilage. Now, malleus, incus and sphenomandibular ligament is not the correct answer. Why? The reason is that malleus, incus and sphenomandibular joint all becomes the derivative of first arch. Only stapes is the muscle. It's the smallest ear or ossicle and smallest bone in our body, which is a derivative of Richard's cartilage. Which is a derivative of Richard's cartilage. So don't worry, I will show you all the details here. You can clearly see all the details. So cartilages of second pharyngeal arch. So please wrote down, cartilage of second pharyngeal arch is called as Richard's cartilage. And the derivatives of Richard cartilage. So I have included all the list. All of you can note down this list. Which of the following, all of the following which I have written here is the derivative of Richard's cartilage. It is stapes, it is stylohyoid process, it is stylohyoid ligament, small corona of hyoid bone and superior part of the body of hyoid bone. So all of you please complete this list of the derivatives of Richard's cartilage, which is the derivative for second arch cartilage, and the derivatives include stapes bone, styloid process, stylohyoid ligament, smaller corona of the hyoid bone and superior part of the body of hyoid bone. Then let's move on to the third MCQ. Which of the following structure passes through triangular interval of arm? Which of the following structure is passing through triangular interval of arm, whether it is radial nerve, axillary nerve, median nerve or ulnar nerve? Question number third. which of the following structures passes through triangular interval of arm? So 4 options are there, mark the correct answer. Whether it is radial, axillary, median or ulnar nerve. Okay, so waiting for the answers. So triangular actually the question is directly asking you the interval which we see in the scapular region. So here the correct answer is the triangular interval. Which of the following structure passes through triangular interval of arm? The correct answer here will be radial nerve. A is the correct answer, radial nerve. So yes, Sri Rangraj, actually it's a for arm, okay. So yes, you can get confused with axillary nerve. So I think you have thought that it is upper scapular triangle, you have thought it's the upper, no, it's a triangular interval. So that is the interval, triangular interval of arm. So 2 structures passes, radial nerve and that of profunda brachii artery. 2 structures passes, radial nerve and profunda brachii artery. Let me show you the explanation for it, don't worry. So can you see when this is how we can understand what are the spaces which is lying on the posterior aspect of scapula, that is called as subscapular spaces. So these are the spaces. We have got one quadrangular. So what we can say, we have got one quadrangular. So this is the quadrangular space. We have got upper triangle and we have got lower triangular space. So see here. So these are the spaces which is lying. We have got a quadrangular space, upper quadrangular space, we have got an upper triangular and lower triangular space. So in this MCQ they were targeting the lower triangular space. So upper triangular space, what are the boundaries? Teres minor on the upper aspect, superior boundary, okay. Teres major on the lower aspect. There will be laterally the surgical neck of humerus, laterally surgical neck of humerus and medially long head of triceps. When I am talking about the, so this is what? Quadrangular space, this is UT, that is upper triangular space, and this is LT, that is lower triangular space. So lower triangular space, superior border is teres major muscle, medially long head of triceps and laterally the humerus shaft. The upper triangular space, superiorly is the teres minor, lower is the teres major, medially is the laterally is the long head of triceps, okay. So this is the boundaries. This is a schematic diagram explaining you the boundaries of upper lower triangular spaces and quadrangular space. Now this is another image which is showing the same thing, which so here we have already done. This is the quadrangular space, this is the triangular space, and we are now already knowing the boundaries of each spaces, okay. We are now done with the boundaries of each spaces. Now what is important, that which structures is passing. So the structures passing from quadrangular space is the artery and the nerves, okay. So here the nerve which is passing is the axillary nerve, and the artery is posterior circumflex humeral artery, which passes from upper quadrangular space, and here only one artery passes through upper triangular space, that is circumflex scapular artery. And from lower triangular space, one artery and one nerve. This was asked in the MCQ, one artery and one nerve. The name of the nerve is radial nerve, and the name of artery is profunda brachii artery. So is it clear to everyone now? Is it clear? Is it clear to everyone? The structures passing through quadrangular space, upper and lower triangular space. Everyone? Is it clear, Rangaraj, everyone? Robin? So let's move on to the next MCQ. Now let's move on to the next MCQ. Got it, everyone? Yeah. So question number 4. Posterior longitudinal ligament continues as becoming which ligament? Posterior longitudinal ligament continues as becoming which ligament? Okay. Whether it becomes apical ligament, alar ligament, membrana tectoria or transverse ligament. Posterior longitudinal ligament becomes which ligament as it continues upward? Question number 4. Posterior longitudinal ligament continues as becoming which ligament? The answer is absolutely right, absolutely right. It becomes membrana tectoria. Yes, absolutely right. It becomes membrana tectoria is the correct answer. Absolutely right. So, see here I have written the facts also. Posterior longitudinal ligament is situated within the vertebral column and it extends along the posterior aspect of the bodies of the vertebra. It is extending across the posterior aspect of the body of vertebrae and it starts from the body of axis and continues with the membrana tectoria, and lower down it is continuing with the sacrum. So, lower down it is attached to the sacrum and upper aspect it continues becoming membrana tectoria. Absolutely right, absolutely right. So, I would like to show you this diagram where you can see membrana tectoria. This is the posterior longitudinal ligament as shown in the diagram, okay, and on the upper aspect it is becoming continued as the membrana tectoria, tectorial membrane. Yes, absolutely right. Now moving on to the next. Brachial cyst arises due to the reason of persistent of urachus, thymus, thyroglossal tract, failure of obliteration of second branchial cleft. So, what is the correct answer? Question number 5th. Brachial cyst arises due to, the reason is failure of obliteration of second branchial cleft, persistence of urachus, thymus, thyroglossal tract. So, my dear students, the correct answer here will be failure of obliteration of second branchial cleft. Yes, absolutely right. Yes, absolutely right. Failure of obliteration of second branchial cleft is the correct answer. And see here, the brachial cleft cyst is a congenital epithelial cyst arising from the lateral aspect of the neck, and usually the reason of formation of its formation is failure of obliteration of second branchial cleft during the embryological development. So, when you will see, it is a mass which is seen from the enlarging mass on the lateral aspect of the neck. It increases with the size with after an upper respiratory tract infection. So, it increases in size after upper respiratory tract infection. I will also like to show this diagram where you can see the swelling is lying in relation to sternocleidomastoid muscle, and it is a swelling which is lying on the lateral aspect of the neck. Now, level of spinal cord at birth. What is the level of the spinal cord at birth? Level of spinal cord means what is the ending point of spinal cord at birth? The most correct answer is upper border of L1, lower border of L3, upper border of L3 or lower border of L1. Question number 6. Absolutely right. Yes, it's the upper border of L3. The correct, so actually sometimes the students get confused with L3 only. We know that the spinal cord at the time of birth lies at the level of L3, but it is also precise that you should know that which border, upper or lower. The correct answer is at the upper border of L3, at the upper border of L3. So, my dear students, see here in the embryo during the initial phase, it is corresponding to each other, but after that the vertebral column start developing at a faster rate in comparison to spinal cord, and at birth it will correspond to upper border of L3. So, at the birth it is corresponding to upper border of L3, upper border of L3, and at the adult region it corresponds to lower border of L1, lower border of L1, the ending of the spinal cord. Until the 3rd month of intrauterine life, in the embryo, both the spinal cord and that of vertebral column is corresponding to each other. Yes, Rangraj, absolutely right. Now, primary curvature of the spine is seen in which of the following reason? Primary curvature of spine is seen in which of the following reason? Thoracic, cervical, lumbar or none? Question number 7. Primary curvature of spine is seen where? Thoracic, cervical, lumbar or none? Thoracic, cervical, lumbar or none? So yes, mixed bundle of answers are coming up. Yes, thoracic is absolutely right answer. Yes, thoracic region is absolutely right answer. Absolutely right answer. Actually, thoracic region and the sacrum region is maintaining the primary curvature of flexed region. So see here, we have got thoracic and sacral is kyphotic curve. Actually, it is termed as primary curvature. They are same as present in the fetus, and the cervical and lumbar is showing lordotic curves, and they are called as secondary curves, which is developed after the birth. So actually cervical curve appears when the baby has got the neck holding capacity by 4 to 5 months, and it can vary till 6 months, also 4 months it appears. And lumbar when the baby starts to stand up or walk, then there is lumbar curvature form generally at 1 year. So yes, so we have got, see here in this diagram, there we have got 4 curvature. In the case of cervical region and the lumbar region, they are secondary curvatures. And in the case of thoracic and sacral region, they are primary curvatures, same as the fetus. Got it? Let's move on to the next. What are the muscles necessary to raise the arm? The muscles necessary to raise the arm. What are the muscles which are necessary to raise the arm? So 4 options are there. The first muscle is supraspinatus, next is deltoid, and then serratus anterior, or it is the deltoid, supraspinatus, serratus anterior. So combination of muscles has been given. As you can see here, combination of muscles has been given. So pick the right one. Question number 8, pick the right one. What are the muscles necessary to raise the arm? A, B, C or D? First, initiation of raise the arm means abduction movement. Actually, yeah, the correct answer will be A. So here what happens if we talk about initiating? So supraspinatus is causing initiation of abduction. It causes first 15 degree of abduction. It causes first 15 degree of abduction. First 15 degree. Next is 15 to 90 degree is caused by 15 to 9 deltoid, and overhead greater than 90 degree is caused by serratus anterior. So this is how the total abduction is caused. So actually, if you want to note down, you can write it also. So those who want to write it, write down. This is an important point. Initiation of abduction is done, that is 0 to 15 degree is done by serratus anterior muscle. (15 degree to 90 degree is basically done by deltoid muscle. Which fibers of deltoid? Acromial fibers of deltoid. Acromial fibers or middle fibers of deltoid, and greater than 90 degree is done by serratus anterior muscle, that is overhead abduction by serratus anterior muscle, taking contribution also from the upper lower fibers of trapezius muscle. So this is the right details. Okay, yes. Now I also want to show you this diagram. This will show you the whole of abduction, how it takes place. Actually, at the first point when the abduction has been started, the arm is hanging by the side and 90 degree of abduction is clearly done. After that, you can see no articular space is left. No articular space is left between the glenohumeral joint. So thereafter, lateral rotation of arm is done, and after lateral rotation of arm and humerus, a space is created and more of abduction is possible. Thereafter, forward movement of the scapula is done so that a full of 180 degree of abduction is possible. So a full range of 180 degree of abduction is possible. Let's move on to question number 9. All of the following are boundaries of Hazelback's triangle except. All of the following are boundaries of Hazelback triangle except. Which of the following structure is not forming the boundary of Hazelback triangle? Lacunar ligament, inguinal ligament, lateral border of rectus abdominis, inferior epigastric artery. According to you, which is the correct answer? Question number 9. Question number 9, try your luck. Which of the following structure is not forming the boundary? So yes, lacunar, yes, lacunar ligament is absolutely correct. Yes, lacunar ligament is absolutely correct. Actually, let me give you a mnemonic how you can remember the rib. So yes, rib. So you can remember the Hasselbalch triangle by a mnemonic RIP, R-I-P, R for rectus abdominis, I for inferior epigastric artery, and P for Poppart's ligament. What is the other name of inguinal ligament? It is called as Poppart's ligament. So you can know the boundaries of Hasselbalch triangle by hearting this mnemonic RIP, R-I-P, RIP. Okay. So no worries, it will be easy for you to understand. So RIP is the boundary. So here how you can understand, let me tell you. So this triangular space which you are seeing, this triangular space which you are seeing is the Hasselbalch triangle. It's the Hasselbalch triangle or inguinal triangle. So it is, if you will see here, if you will clearly see, okay, this is which muscle? This is rectus abdominis muscle. This is the rectus abdominis muscle. This is rectus abdominis muscle. Okay. This is rectus abdominis muscle, lateral border. This is the rectus abdominis muscle, lateral border, and inferiorly if you will see, okay, this is the inguinal ligament. Okay, this is the inguinal, this whole is the inguinal ligament. Okay, this whole is the inguinal ligament as shown here also, and lacunar ligament we know that it is the medial extension. So but inguinal ligament is the correct answer, which is, so the confusion was in that only, I think, to you. So this is the inguinal ligament, and inguinal ligament is forming, this is inguinal ligament, inguinal ligament is forming the inferior border, rectus abdominis lateral border is forming the which border? It is forming the medial border for Hasselbalch triangle, and you can see inferior epigastric vessels are lying here. You can see this is the inferior epigastric vessel, and inferior epigastric vessel is forming, inferior epigastric vessels are forming which border? Lateral border. So is it clear everyone? Yeah, so we have done with the medial border, the inferior and the lateral border. Okay, and which herniation occurs through? Which herniation occurs through this space? The direct inguinal hernia medial to inferior epigastric vessels. So let's move on to the next. Clavipectoral fascia is pierced by which of the following? Clavipectoral fascia is pierced by which of the following? Clavipectoral fascia is pierced by which of the following? Question number 10. Clavipectoral fascia is pierced by which of the following? Whether it is axillary vein, axillary artery, brachial artery or cephalic vein. Okay, clavipectoral fascia. Question number 10. What is the correct answer? Four structures pierces clavipectoral fascia. One of the structure is mentioned here with a question mark. Okay, axillary artery, one of the branch is piercing dear. So actually the correct answer is cephalic vein. Yes, Sri, yes, yeah, cephalic vein is the correct answer. Four structures: cephalic vein, lateral pectoral nerve, lymphatics and thoracoacromial artery. These four structures pierces clavipectoral fascia. So see here, the structures piercing clavipectoral fascia has been shown here. This is the clavipectoral fascia. You can see the clavipectoral fascia getting highlighted as I saw. Okay, which is merging lower down with the pectoral and axillary fascia. Structures piercing are, the structures piercing are cephalic vein, lateral pectoral nerve, lymphatics and thoracoacromial. These four structures are piercing the clavipectoral fascia. So cephalic vein is the right answer. Moving to suboccipital nerve is the ventral ramus of C1, dorsal ramus of C1, ventral ramus of C2 or dorsal ramus of C2. So what is the correct answer? Four options are there. Mark the correct answer. Suboccipital nerve is pierced by which of the following? Suboccipital nerve is pierced by which of the following? Question number 11. Is which nerve? So actually the correct answer, question number 11, is C1 dorsal. So C1 cervical nerve dorsal ramus, cervical nerve dorsal ramus. So dorsal ramus of cervical nerve, dorsal ramus of cervical nerve is called as suboccipital nerve, is called as suboccipital nerve. Yeah, it's the dorsal ramus of C1. Okay, so my dear students, suboccipital nerve, I have written here, don't worry. Suboccipital nerve is the first cervical nerve, dorsal ramus, dorsal rami, and it is exactly passing between skull and first cervical vertebra, and it is supplying the muscles of suboccipital region. What it is doing? It is supplying the muscles of suboccipital region. So here you can see it's an important content of suboccipital triangle. So see here, the dorsal ramus of first cervical nerve is emerging in which triangular space? It is emerging in which triangular space? It is emerging in the suboccipital triangle, and it is emerging and it is supplying the muscles in the vicinity. It will give innervation to the muscle of suboccipital region, rectus capitis posterior, major, obliquus capitis superior, inferior, and here we can see obliquus capitis superior is forming suprolateral boundary for suboccipital triangle, obliquus capitis inferior is forming inferior boundary of suboccipital triangle, and rectus capitis posterior, major and minor is forming the medial border of supromedial border of suboccipital triangle, and it also contains the vertebral artery. One of the important contents lies here, that is the vertebral artery. So done it. Posterior atlanto-occipital membrane is lying in the floor of the suboccipital triangle. It's lying in the floor of suboccipital triangle along with the, which is not shown, that is the atlas posterior ramus also lies. Okay. So done, let's move on to, so here you can see it supplies, if we talk about the muscles getting innervation from suboccipital nerve, it supplies the muscles of suboccipital triangle, that is rectus capitis posterior, major, obliquus capitis superior and obliquus capitis inferior. Suboccipital nerve also innervates the rectus capitis posterior minor. All of you please note down, the muscle supplied by the suboccipital triangle is rectus capitis posterior, major, obliquus capitis superior, obliquus capitis inferior. Suboccipital nerve also innervates rectus capitis posterior minor. Now, coracohumeral ligament is degenerated tendon of which of the following? Coracohumeral ligament is degenerated tendon of which of the following? Whether it is biceps brachii, coracobrachialis, pectoralis minor or latissimus dorsi. According to you, which is the correct answer? Question number 12, correct answer. Coracohumeral ligament is degenerated tendon of pectoralis minor is the correct answer. Yes, it's a degenerated tendon of pectoralis minor. Absolutely right. So see here, coracohumeral ligament is actually extending from lateral margin of the root of coracoid process and getting towards that of the tuberosity of the humerus. So you can clearly see this is the coracohumeral ligament. It is morphologically degenerated tendon of pectoralis minor. Now, which structure lies in paraduodenal fold? Which of the following structure is located in paraduodenal fold? Which of the following structure is located in paraduodenal fold? Whether it is superior mesenteric artery, splenic vein, inferior mesenteric vein or gastroduodenal artery. Question number 13, mark the correct answer. So let me mark it. Actually, the correct answer here is inferior mesenteric vein. Inferior mesenteric vein. Okay, inferior mesenteric vein lies in the paraduodenal fold. Paraduodenal fold. Inferior mesenteric. Don't worry, I have written all the facts and you can revise it. So actually we have got many duodenal spaces and recesses. When we are talking about superior duodenal recesses, it is located in the upper end of the fourth part of duodenum, and it is its direction is looking down, and it's if we talk about inferior duodenal recesses, it is below the superior recesses. It is lying below the superior recesses. Direction is in upward direction. The paraduodenal recesses is the lowest when it is present. It is onto the left part of the fourth part of duodenum. Okay. And exactly behind the paraduodenal fold of peritoneum. The paraduodenal fold is including inferior mesenteric vein. Okay, so this was the question which has been asked. What structure lies in paraduodenal fold? So the correct answer is the paraduodenal fold. The paraduodenal fold is containing inferior mesenteric vein in its free margin. It is containing inferior mesenteric vein in its free margin. I will also show the diagram, don't worry. The other important recesses are retroduodenal recesses, and the retroduodenal recesses is actually, please note down, it is the largest duodenal recesses, but it is infrequently present. But when it will be present, it is exactly between the third and the fourth part of the duodenum. Exact location is between third and fourth part of the duodenum. The prevalence of duodenal recesses, please note down, superior duodenal recesses is more commonly present in 50% cases, inferior duodenal recesses in 75% cases, paraduodenal recesses in 20% cases, and retroduodenal recesses, just now we have seen, it is rare and occasionally present, but inferior duodenal recesses is containing inferior mesenteric vein. Paraduodenal recesses, just now we have seen that paraduodenal recesses is containing inferior mesenteric vein. I would like to show a diagram for it. See here. So this is a very easy diagram for you to understand. Can you see here? This is the location of inferior mesenteric vein and exactly where it is located, in the paraduodenal recesses. Okay, in the paraduodenal recesses. Other than that, superior mesenteric vessels is lying in the mesenterico-parietal recesses. Mesenterico-parietal recesses and retroduodenal recesses are sometimes present. Is it okay, everyone? Got the idea of all the duodenal recesses, what it contains? Also, the content of paraduodenal is inferior mesenteric vein, mesenterico-parietal recesses is crossed by superior mesenteric vessels. Now, duodenojejunal recesses is at times present in 20% of adults, and when it present, it is located at the close to the root of mesocolon and transverse mesocolon, and it is just lying left of abdominal aorta. Now, the other duodenal recesses is mesenterico-parietal fossa of Waldeus. Mesenterico-parietal fossa of Waldeus is only present in 1% of adults, and it is located upper part of mesentery. So just in the diagram also I have shown you superior mesenteric vessel is lying over it. What structure lies over it? Superior mesenteric vessel. All of you please note down the important duodenal recesses name, location, and what structures are related to it. Now, nerve supply of circumvallate papilla. Next question is nerve supply of circumvallate papilla. Nerve supply of circumvallate papilla. What is it? Whether it is glossopharyngeal nerve, codatympanic nerve, vagus nerve, or lingual nerve. According to you, which is the correct answer? Glossopharyngeal, codatympanic, vagus, or lingual. Which is the correct one? Nerve supply of circumvallate papilla is, the correct answer is glossopharyngeal nerve. Okay, glossopharyngeal, ninth cranial nerve. The ninth cranial nerve is innervating circumvallate papilla. Yes, absolutely right, ninth cranial nerve. So let me show you a diagram for the innervation of the tongue. Palatoglossus muscle is the only one muscle which is innervated by the vagus nerve. All the muscles of the tongue is innervated by hypoglossal nerve, and in the anterior aspect sensory innervation, if we talk about taste sensation, is by codatympanic nerve, general sensory innervation is by lingual nerve in the anterior part. But my dear students, circumvallate papilla, to be more precise, if you will see circumvallate papilla, this is the circumvallate papilla location, and you can see it is getting innervation from glossopharyngeal nerve, both special sensory, both for the special sensory and general sensory. Why? Because it is covered by glossopharyngeal nerve and it is circumvallate just anterior to sulcus terminalis, getting the embryologically it is quite related, and it's supplied by the nerve of third arch. Now, posterior most part and E for epiglottis, it is getting innervation from vagus nerve branch, internal laryngeal nerve. Internal laryngeal nerve. Now, my dear students, so we have got one more. So, we have already covered up NEET PG 2020, 2019, 18, 2017 just now, and the last paper which I want to discuss is NEET PG 2016. So, just at 11 a.m. I will start. So, do join me for the 11 a.m. session. Link will be provided. Boost your medical preparation by taking 2 years of subscription. So, you can take 2 years of subscription and get 4 months of subscription absolutely free to you. Use my code and add 10 to get 10% discount. What you can do, you can use my code and add 10 and avail the opportunity of getting 10% discount. All the best, students. And before ending the session, I also want to tell, if you want to see the sessions, if you want to be the part of my session, use the code and add 10 on the special free platform. Use it as an unlock code and see special free sessions on the Unacademy platform. All the best. Yes, Rangraj. So we will again meet 11 a.m. Thank you. Thank you, students. Thank you.